Hello everyone, this is Dr. Huma Ibrar. I wish you all a good day. So today's topic is all about recent DHA exam MCQs. But before starting, I would like to congratulate Mariam Badar for clearing DHA exam in first attempt. Tomorrow's video will be on recent Saudi license exam MCQs. So stay connected and remember me in your prayers. So let's start. Note down all these points and start preparing for DHA exam. So let's talk about important topics and MCQs from recent DHA exam. Please note down all these points. Definition of concentric exercises, definition of active insufficiency, definition of isometric exercises, picture of Q angle, picture of genoregurgitum, nerve fiber picture, coxa valga, chronexy, Reubase, mechanism of injury of PCL, posterior cruciate ligament, cell membrane action potential, S1 and L5 dermatomes, Babinski's sign, above knee prosthesis, picture of trochanteric fracture, long thoracic nerve muscle supply, definition of muscle performance, rhythmic stabilization for ataxic gait, Milwaukee brace, pulmonary ventilation, Pott's disease, spinal TB, Ebb's palsy, muscle affected, Ebb's palsy, brachial plexus injury. What's the temperature of hydrocollator? Monophasic current example, piriformis palpation, transverse plane, coronal plane, medial rectus muscle injury, homonymous hemianopia, definition of dystonia, Leishman test, radian nerve muscle damage, dorsiflexion of wrist paralysis, muscle spasm, chondromalacia, goal of treatment in chondromalacia, yellow flag psychosocial factor, prone kneeling picture, superficial partial thickness burn, hip range of motion, joint of Luschka. Anyone knows about joint of Luschka? Comment below. Denervated muscle and contraindications of TENS, Pannett's fracture, asthma, breathing techniques, elbow, myositis ossificans, hip, extension plus external rotation stretching, superficial heat modality, musculocutaneous nerve injury, of choice, obese patient with knee pain modality of choice is radian nerve stretch position, milestone, jumping by both legs, 30th month. Milestones are very important. Extra calorie intake for pregnant exercising women, point gait, passive range of motion. After skeletal traction, complete strength is gained in Dashman's, burst fracture, lead pipe rigidity, muscle for climbing stairs and standing from sitting of a chair, CODS, adhesive capsulitis, difficulty in calming, no passive or active range of motion and abduction, that's frozen shoulder, So that's it for today. Thank you for watching this video and stay connected for Saudi license exam recent MCQs also.